my name is Margaret Carino from BSN21, and today I will be conducting a head-to-toe assessment for the newborn. To begin this assessment, when you first walk inside the patient's room, you must introduce yourself before doing any procedure. So, state your name and then verify their identification. To verify the identification, you can check the infant's wristband and then match it with the mother's. Once walking in, you must also check the infant safety. Inside the crib, there must be no stuffed toys or any materials that can cause suffocation or danger to the baby. If so, if there is a stuffed toy on the crib of the baby, then you must do a health teaching to the mother. Teach the mother the danger that the stuffed toy can bring to the baby. And then also have a bulb syringe inside the crib of the baby and do a health teaching about how to use the material. For the bulb syringe, when using it, it should start from the mouth and then to the nose. Tell the mother that the clean side should be done first before the dirty side. Okay, so after doing so, after identifying the client, after doing the health teaching, after introducing yourself, state the purpose of the intervention to the mom. Tell the mom that the purpose of this intervention is to assess the well-being of the newborn infant. After that, we can now proceed with the assessment. Before doing any procedure or having contact with the baby, make sure to wash your hands and put on gloves. Okay, so now we're moving on with the physical examination. For the physical examination, we're going to be taking the baby's anthropometric measurement or the measurement of the head circumference, chest circumference, abdominal circumference, the length, and the weight of the baby. After that, we're going to be checking the baby's level of consciousness or how the baby is acting. For this, we can note that the baby is actively alert. That means he's playing, wiggling around. There are 4 types. There's the sleeping, quiet alert, active alert, and crying. For this, he's obviously active alert. Also, we're going to be checking for the posture. For the posture and movement. For newborn babies, they usually have their arms flexed or their yung kanilang legs nakabukaka siya. Yun yung pagka-newborn sila. This baby is already 2 months old, kaya naman he can assume different kinds of position. Okay, so now we are moving on with the vital signs. For the vital signs of the newborn, there are 3 important ones: the heart rate, respiration, and the temperature. So we're going to start with the auscultation for the heart rate. Why are we doing the auscultation first? We're doing the auscultation first because later on they're going to be more irritable, so they're going to be crying a lot more, and we're going to have difficulty hearing the sound. So we're now going to start with the auscultation. So we're first going to take the heart rate. So we're going to be using the bell of the stethoscope to take the heart rate. And we're going to be taking this for 1 full minute. For the heart rate, it should be between 120 to 140. That is the normal range for the heart rate of the baby. After taking the heart rate for 1 full minute, we're now going to be taking the respiration. For the respiration, we can be looking at the rise and fall of the abdomen, but since we're also going to be checking for the lung sounds, we can do the lung sounds and the respiration together. For the lung sounds, we can be looking at the side of the baby. For the respiration, it should be between 40 to 60 breaths per minute. After that, we're now moving on to check the bowel sounds. So for the bowel sounds, we're going to start at the right lower, and then we're going just clockwise. So we are now done taking the vital signs. we're taking the temperature at last because apparently that's what they hate the most, taking their temperature. So we're going to do it at the last part of the assessment. Okay, so now we're moving on to the actual assessment. We're going to start on the skin assessment. But during the whole duration of this assessment, we're still going to be checking for the skin. But for now, I'm going to be discussing the different components of the skin assessment. So for the skin assessment, we're going to start with the color. So the newborn's color, the normal color for the newborn is the ruddy complexion. Ruddy complexion is yung parang nangingitim sila na namumula. At dahil yon sa mas mataas na increase ng kanilang concentration of red blood cells and decrease subcutaneous fat. Kaya sila meron ruddy complexion. So, si mommy, minsan iisipin nila na si baby nangingitim na baka yun yung kanilang kulay. Pero nawawala naman yun during gradually pagka tumatagal, mas nakikita na natin kung ano yung talagang kulay nila. Kung talaga ba sila yung maputi o kung talaga sila may itim. So the next one is cyanosis. For cyanosis, meron tayong dalawa. We have the peripheral cyanosis and the central cyanosis. So first off is the peripheral cyanosis. Peripheral cyanosis is normal. It's a normal phenomenon in the first 24 hours to 48 hours after birth. Yun yung nangingitim si baby. Pagka cyanotic, di ba nangingitim si baby? So minsan nakakala nila na may sakit si baby kasi nga para siyang nangingitim. Pero peripheral cyanosis is normal lang naman. Para din malaman natin kung normal siya, then we can check the vital signs. Pagka naman normal yung vital signs ni baby, then ibig sabihin, peripheral cyanosis lang yun. Mawawala din yung pangingitim niya na yun. Bakit nangyayari si peripheral cyanosis? Peripheral cyanosis happens dahil immature pa yung kanyang peripheral circulation. Kasi nga, kakalabas niya lang mula sa sinapupunan ni mommy, mag-a-adapt pa lang siya sa bagong environment niya. So the other one is the central cyanosis. So si central cyanosis, that is the mayroong decreased oxygenation, decrease yung oxygen ni baby. So that can be either due to respiration blockage or respiration obstruction, or meron siyang underlying diseases na need ng immediate attention. So for that, ang malalaman natin dyan pagka nag-take tayo ng vital signs kay baby, yung kanyang paghinga is irregular or meron siyang difficulty breathing. And also, yung kanyang heart rate and yung kanyang respiration rate is either masyadong mataas or mababa kumpara doon sa normal na range. And you can also see the difficulty in breathing doon sa kanyang nasal flaring, kung meron siyang nasal flaring, kung lumalaki yung butas ng ilong niya kapag humihinga. Ibig sabihin nun, nahihirapan si baby huminga. So after that is the vernix caseosa. Ito yung makikita natin na parang siyang white na cheese-like substance kay baby, nakapaikot kay baby. And this serves as a lubricant and also for heat loss para maprotektahan natin si baby from heat loss. And dati tinatanggal to, pero ngayon hindi na siya tinatanggal dahil nga meron siyang purpose. And this usually goes away too. So wag nating kutkutin yun or wag nating tanggalin dahil kailangan pa yun ni baby. So now we're checking for any lanugo. Lanugo is the fine down hair that we can find on the babies. And these are usually found on the shoulders, the back, sometimes it's on the ears, forehead, and such. This usually goes away within a few days. Babies can also develop desquamation. Desquamation is the peeling of the skin of the baby, and they can be usually found on the skin and on the soles of the feet. And we should tell the mother to not play with it. Huwag nilang kukutkutin, huwag nilang gagamutin, or huwag nilang babalatan, ganon. Kasi mawawala din naman siya in the course of a few days. Normal naman yun sa kanila. For milia, it is because of immature pa yung kanilang sebaceous glands, kaya meron pa silang milia. Ano ba yung milia? Milia is the white papules na makikita natin kay baby. And those are usually found sa kanilang muka. We can find it on their eyes or on their body para silang maliliit na mga pimples. And then we should tell the mother na wag nilang puputukin yung mga yun or wag nilang gagamutin dahil lang normal yun. Nawawala din yun. During 2 to 4 weeks, mawawala na siya. And ang milia is, para malaman natin kung kailangan na bandalin si baby sa ospital dahil sa mga yun, is pag pumuputok na siya, nagkakos na siya ng lesion or parang nagiging sugat na siya. And kung yung kanyang odor is hindi nakamaganda. So then we should go to the hospital and get it checked. For the skin turgor, we're looking at the elasticity of the baby's skin. Pagka naman dito, ang gagawin natin is we're going to slightly pinch. Hindi naman pinch, but we're going to grasp the baby's hands with our thumb and finger. Tapos, pagka ganun, pag nilet go natin siya, it should go back to being smooth. Pagka pinch natin siya na ganun, pag ginas natin yung kamay ni baby na ganun, tapos hindi siya bumalik sa normal and it stayed in a elevated position, then that can mean that the baby is severely dehydrated. For the Mongolian spots, this is yung parang bruising or yung parang balat ni baby. Woo! Nawawala siya at the age of 7 or mas earlier. Yun yung parang siyang bruising kasi yung kulay niya is late gray to blue-black. So mukha siyang bruise or balat nga. Makikita natin to around the lumbosacral and buttocks area dun sa pang-upo ni baby. And this happens due to the accumulation of melanocytes dun sa kanilang dermis. So we're now going to be assessing the infant's head. For the assessment of the infant's head, we're going to be taking off their bonnet kung meron silang suot na bonnet. But the infant that I have with me right now is not wearing anything. So for this, we're just going to run over our hands over their head. So right here, and we're going to be checking for their suture lines. For the suture line, there are two types. There are the corneal suture lines and the sagittal suture lines. For the sagittal, it's right here. It runs over here. Oops. And for the corneal suture lines, it's right here. And also know that they have two kinds of fontanelles that we need to protect kasi hindi pa sila totally nagsasara. This is the anterior fontanelle. Nandito sa kanilang parang crowning. And then meron silang anterior fontanelle, and the one is at the back. Medyo maliit yun, kaya hindi siya masyadong nadidetect. For the anterior fontanelle, it's right here. Ito yung parang malambot sa kanilang head, and we must protect that dahil hindi pa nga siya totally closed, mabilis yung access sa kanilang brain. So, delikado yun pagka nahulog si baby or pagka nasundot ng ma-pressure. So, protect that part. So, the two kinds of abnormalities naman na makikita natin sa head ni baby is the caput succedanum and cephalohematoma. With the caput succedanum, yun yung edema or yung swelling ng scalp ni baby. Meron siyang fluid accumulation. So, ang nangyayari doon is, pagka si baby meron siyang prolonged labor during delivery, masyado nagkakaroon nga siya ng swelling sa edema sa kanyang scalp. Yung cephalohematoma naman is pagkatuko naman yung nandoon sa kanyang scalp. And this usually happen dahil sa trauma na mismo. Kunyari, si baby, habang pinapanganak, nahulog kasi masyadong madulas, magkakaroon siya ng cephalohematoma. And this usually goes away weeks to months. Sa caput succedanum naman, within days, nawawala siya. Okay. So now for the eyes, we're going to be assessing the eyes using a Bell light. So we're just going to shine the sunlight on their eyes and then titingnan natin yung mata niya kung meron ba siyang redness, kung meron ba siyang mga discharges. Yung mga yan dapat alayon kay baby. So take note kung meron ka makikita mga ganon. And also we're going to check if there are any abnormalities such as subjunctival hemorrhage or ophthalmia neotorum. So, check lang natin yan, assess natin yun kay baby. Okay, so now we're going to be checking for the ears. We're going to be assessing the ears. So, pag in-assess natin yung ears ni baby, we're going to look kung yung kanyang eyes ba, yung inner canthus to outer canthus, sa eyes ni baby is ka-level yung kanyang upper part na external ear going around the back, across the head, tapos dun sa kabila din. So, to check that, we're just going to look at the inner canthus to the outer canthus kung pantay ba siya dito. Kung hindi siya pantay, kung hindi siya level at mas mababa yung kanyang ears kaysa sa kanyang eyes, then that can be an indication of Down syndrome. Okay? So, si ears, meron din siyang, note din natin kung dalawa ba yung ears ni baby. And for this, dalawa naman yung ears ni baby. So, that's good. And then, we're also going to check for any malformation sa kanyang ears. And we're also going to be checking for the ear recoil. So, ang gagawin lang natin doon is we're going to just push it down and then it should go back to its normal anatomical state. Okay? So, we're going to check for the ear cartilage. For this, we're going to run our fingers along the pinna to feel if it's firm and if it's along the edge. So, just this. Ganyan. So now we're moving on for the assessment of the nose. For the nose, ang gagawin natin since si baby is a nose breather, ang gagawin natin is we're just going to cover one nostrils to assess if si baby nakakahinga pa din ng mabuti. So just do it on both nostrils. Just do that and then check if he can still breathe. So now we're moving on with the assessment of the mouth. For this, we're going to look kung meron ba si baby cleft lip, cleft palate, or kung meron ba siyang tongue tied, Epstein pearls, yun, ino-note natin kung meron mga ganun. For the cleft lip, meron siyang dalawang type. We have the unilateral and bilateral cleft lip. Pagka sinabi natin unilateral, yun yung isa lang, sa isang side lang. Tapos bilateral is pag dalawa yung cleft lip niya. So for this, pwede naman siyang operahan. Mas magandang operahan siya while bata pa kasi pagka tumanda si baby at hindi siya naayos, pwede yung mag-cause ng insecurity with their appearance, okay? And then the other one is the cleft palate. For the cleft palate, we're going to insert our finger inside the baby's mouth to check for the palate. Ate, pwede kong gawin mo. So, we just check yung kanyang cleft palate. Kung meron ba si babying cleft palate dun sa kanyang mouth. Kung meron si babying cleft palate, mahihirapan siyang kumain. Mahihirapan siyang i-feed, breastfeeding, ganun. And then we also check for the sucking reflex. As we can see, si baby, nagsuck siya ng finger nung pinasok ko sa mouth niya. That is a sign of sucking reflex. So, the other one that we're looking at is the rooting reflex. So, if we do this sa face ni baby, if we run our finger across the baby's face, tapos itinur niya yung head niya doon, ibig sabihin, okay yung rooting reflex niya. Pero pero minsan hindi yun nangyayari. Minsan the baby doesn't follow the fingers kung saan gawin siya dahil kakadede niya lang kung busog siya or pagka naman preterm siya at hindi pa fully develop yung kanilang sucking reflex. For the rooting reflex, kakakain lang ni baby kaya hindi siya kakadede lang ni baby, kaya hindi siya nag-turn dun sa aking fingers. So, moving down, we're now going to be assessing the baby's neck. For the baby's neck, it's usually short and chubby. Tapos, check natin yung kanyang skin fold. Sa neck ni baby, doon sa skin fold ni baby, doon natin makikita yung mga vernix caseosa pagka newborn pa lang. Doon sila usually nagtatago sa neck niya. Okay? So we are now moving on with the chest assessment. For the chest assessment, we're going to note for any discoloration do sa chest niya. And also, as we can see that the chest is smaller than the head, pero it can have an engorgement. And also, the baby can have thin, watery secretions, and that is known as the witch's milk. Nawawala din naman yun. The only time na ikakabahala natin yun or magiging concern natin yun is pagka yung secretion na yun is mabaho na siya, meron na siyang foul odor, then that's when we need to record it and report. So we're now moving on with the arms. The baby's arms, pagka newborn sila, they have to be flexed and that is a good sign of muscle tone. And then we're also going to be checking their fingers. So pagka i-check natin yung fingers nila, we need to have to count yung kung ilan bang fingers kada each hand. So for this baby, 1, 2, 3, 4, 5 fingers each hand, then that's good. Yung mga abnormalities na pwede natin makita sa fingers nila is polydactyl or kaya naman sandactyl. Pag sinabi natin polydactyl, yun yung meron silang extra fingers. Tapos pag sinabi sandactyl is pagka yung fingers nila is parang magkadikit. Okay. And then during that time, we can also check yung kanilang reflex. Yung kanilang grasp reflex. So pagka nilagay natin yung fingers natin dun sa kanilang hands, they should grasp it. Ibig sabihin nun, hawakan mo yung fingers ko. Ibig sabihin nun, meron silang grasp reflex. Okay, so now we're moving on to the abdomen. Sa abdomen, ang gagawin natin is we're going to auscultate for any bowel sounds. Pero ginawa naman na natin siya nung una kasi right now, as you can see, the baby is very irritated na. So kung ginawa natin yung auscultation ngayon, mahirapan tayo dahil nga sa loud sounds nila. So we already did that. And we're also going to do some palpations. We're going to be palpating for the liver and the spleen. Sa liver niya is nasa right upper margin. So, ipapalpate lang natin yon to check for the liver. And then, the opposite is for the spleen. Palpate lang natin siya. And then, we can also be noting for the skin while doing this. Okay, so moving down, we're also going to be checking for the umbilical cord. Si baby is already 2 months old, so the umbilical cord is already gone. For the umbilical cord, kung newborn si baby, we're going to check for any redness, any discharges, kung may swelling ba doon, then we have to take note of those. And we're also going to check, pagka bagong panganak pa lang siya, yung umbilical cord na, it has to have 2 arteries and 1 vein. Okay? Okay, so we're now moving down sa kanyang lower extremities. We're going to be checking the feet. For the feet, we're also going to be counting kung ilan yung kanyang toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And same thing sa kanyang fingers, kung meron siyang extra, it's called polydactyl. And pagka naman meron siyang fusion sa kanyang mga fingers, then it's called sandactyl. Okay? And then, we can also check the reflexes. So this, meron tayong dalawang reflex, plantar reflex. Pagka nilagay natin siyang ganun, tapos nag-grasp yung kanyang toe sa ating fingers, then that's a plantar reflex. The other one is Babinski. Pagka ginanito natin siya sa finger ni baby and nag-flare out yung kanyang toes, then that means that meron siyang Babinski's reflex. Okay. So now we're going to be moving on to assess the back of the baby. So for this, check natin yung kanyang back. Tagilid ka, bebe. Tagilid ko. Andali lang. Oo. We're going to be checking the back. It should be flat. It should be flat. There should be no dimpling. There should be no holes. Kasi pagka may ganun, it can be a sign of spina bifida. And also, pagka chinek natin yung kanyang back, pwede natin makita yung Mongolian spot or yung parang bruising, parang balat. Dun sa kanyang gawing pang upo. So, that's the back assessment. And now, we're going to be assessing the genital area. So, for the genital area, pag in-assess natin siya, tatanggalin natin yung pampers ni baby, pero I'm not going to do that in this assessment. For that, we're going to be checking the baby's genitals. In this case, the baby is a boy. So we're going to be checking the penis and the meatus. After conducting the head-to-toe assessment, we can now proceed with making the newborn comfortable. After that, we can discard any materials that we used, remove gloves, do hand washing, and then document the findings on the patient chart. Thank you.